This is the recording for Chapter 13, Male Reproductive System. Pathology that we see of the male reproductive system. For some reason, the textbook put all of the sexually transmitted diseases in underneath the male reproductive system. So we will talk about each one of those. Basically, a sexually transmitted disease is a contagious disease acquired as a result of sexual activity with an infected individual. So we talked about COPD being an umbrella term, and asthma, chronic bronchitis, and emphysema falling underneath that umbrella. So the same goes with this, that sexually transmitted diseases is the umbrella, and then the different types that fall underneath that include gonorrhea, syphilis, chlamydia, genital herpes, AIDS, and HIV. Gonorrhea then is a sexually transmitted disease that can go undetected because the patient is asymptomatic until the disease has spread. For women, they have greenish yellow cervical discharge, and for men, they have inflammation of the urethra, difficulty urinating, and discharge of pus from the penis. Chlamydia is one of the most prevalent and most damaging STDs in the United States. It is often a cause of infertility in females if it's left untreated. Symptoms are often absent or mild, and it has symptoms for a man being urethritis, which is inflammation of the urethra with whitish discharge from the penis, and for women, cervicitis, so that would be inflammation of the cervix with a mucopurulent discharge, which is like a snotty mucus-like discharge. Syphilis is a sexually transmitted disease where the patient develops a ulceration at the point of where the virus entered the body. And so where that enters the body, the sore erupts, and that sore is called a chancre. And so you'll see here in the picture that they can appear on the shaft of the penis, the head or up higher, and then on the labia majora, labia minora in a female. Genital herpes is a sexually transmitted disease that causes red blister-like sores. So the herpes simplex virus, one of the strains of this, causes it. And these patients develop a blister-like rash in the genital area. Infected women have a much greater incidence of cervical cancer or miscarriage after having had genital herpes once they have acquired genital herpes. The picture for this is this one here on a female for the labia majora. You see this bubbly vesicular type rash, and so that's extremely painful for the patient. However, once they develop the rash, and here it is on a male, you can see the blistery like rash all over the scrotum and then the penile shaft. Once a patient has genital herpes and then the sores go away, they still have genital herpes. So they have genital herpes for life once it's acquired, and they will go through what are called periods of outbreaks. However, once the rash and the blisters goes away, which it will with medications, they still have the virus, and they can still transmit it to another partner by viral shedding. And viral shedding is when the virus is present on the skin even when there are no lesions present. Genital warts then are caused by HPV, which is known as the human papillomavirus. For women, the warts can be on the vulva, in the vagina, or on the cervix, so they don't necessarily have to be visualized by the naked eye. They can be hidden. For men, they usually are present on the penis or around the rectal area. And the thing that is most notable about genital warts is that 80% of cervical cancers are linked to an HPV infection. So once a female has had an HPV infection, her likelihood of developing cervical cancer goes up quite a bit. Trichomoniasis is an infection caused by a protozoa. It causes vaginitis, inflammation of the vagina, inflammation of the urethra, and inflammation of the bladder. So with the STDs, the gonorrhea, the chlamydia, syphilis, and those three. those are treated by 1 week's worth of antibiotics. Then the patient is cleared of the disease. However, with genital warts and with genital herpes, again, once you get the virus, you have it for life, so there is no getting rid of that. Same thing for HIV. Benign prostatic hyperplasia or hypertrophy is a normal occurrence that we see in males starting about age 50 and over. As a male gets older, the prostate gland enlarges and it decreases the urethral lumen. So if you remember, the urethra is the tube that is passing the urine from the ureters, from the bladder to the urethra to the outside of the body through the urinary meatus. Treatment for BPH, that's the abbreviation for benign prostatic hypertrophy, BPH. Treatment is surgery. And you can see here from this diagram when the prostate is this red area, this red gland here. And so when that swells up, it pinches on this tube, which is the urethra, and it decreases the lumen, or it decreases the ability for the bladder to drain down in and pass through the urinary meatus. So that's when the patients will start to have hesitancy when they urinate. They'll have a lot of nocturia, or urinating during the night, where they have to get up multiple times through the night to urinate. Bladder neck obstruction, or a BNO, is blockage of the bladder outlet. Sometimes this is caused by an enlarged prostate gland. It could be from a calculus. If you remember, calculus means stone. Could be a blood clot or a tumor, and it may cause hydronephrosis. If you remember what that is backflow of urine into the kidney when the urethra is obstructed, and then it causes dilation of the kidney, and the urine is no longer able to flow down through the ureter to collect into the bladder. Cryptorchidism. In this chapter, we're going to learn that orchid means testicle and crypto means hidden. So this is failure of the testes to descend into the scrotal sac prior to birth. So sometimes little boys are born with their testicles still up in their abdomen. They have not yet descended. So treatment is orchiopexy, which is surgical suspension of the testes. However, they typically wait until the child is 2 years of age before they go ahead with this surgery, because sometimes during the first 2 years of life, the testicles will drop on their own down into the scrotal sac. Oncology that we see of the male reproductive system. Carcinoma of the prostate is the second most common cancer in men. It is usually found after age 50, and specifically those of African descent. When a patient has carcinoma of the prostate, they have symptoms of difficulty starting and stopping their urine stream, painful urination frequency, and hematuria, which is blood in the urine, which is carcinoma of the prostate is stimulated by testosterone. Prevention for carcinoma of the prostate, males at age 50 and over yearly should get a blood test to screen for prostate cancer, and they can have a test done which is known as a PSA, prostate-specific antigen. And they also require a digital rectal examination. For treatment of carcinoma of the prostate, they recommend prostatectomy, which is removal of the prostate and radiation. They may also recommend bilateral orchiectomy, which would be bilateral removal of the testicles to decrease the amount of testosterone, so that the testosterone doesn't continue to feed the prostate tumor. Here's a picture of a digital rectal examination. So when they check the rectal area, what the physician is doing is putting his finger into the rectum and then palpating the backside of the prostate gland. And so in doing that, they can feel the prostate gland to see if there's any lumps, any bumps, any enlargement that would be suspicious for a potential prostate tumor. Testicular cancer is a cancer that's found in younger men, most common in the ages of 15 to 34. Symptoms are testicular swelling, a lump, or pain, which is accompanied usually by lower back or abdominal pain. If found in its earliest stages, it is treatable, and that is why we recommend to our patients to do a monthly testicular self-exam, TSE. Terms to know from the textbook, starting on page 438, the term balanitis is inflammation of the skin covering the gland's penis. Digital rectal examination, we just talked about that. That can be found on page 441. Transurethral resection of the prostate. This is a surgery that is done to help with patients that have benign prostatic hypertrophy. So they can actually go in and excise part of the prostate gland to allow the urethra to no longer be pinched and allow the urine to flow through that urethra more freely. A vasectomy is removal of all or a segment of the vas deferens for male sterilization. Prostatectomy, then, is surgical removal of the prostate gland. And then prostate-specific antigen is the blood test used to detect a prostatic disorder. Spelling words to know for the quiz: lithotripsy, perineal, vasectomy, nocturia, spermicide, polyuria, dialysis, prostatectomy, varicocele, trichomoniasis, chlamydia, gonorrhea. Abbreviations you need to know for this chapter, page 445. BPH stands for benign prostatic hyperplasia or hypertrophy. DRE, digital rectal exam. HPV, human papillomavirus. PSA, prostatic specific antigen. STD, sexually transmitted disease. TSE, testicular self-examination. And TURP, transurethral resection of the prostate. Make new flashcards for your word elements between pages 432 through 434. And memorize the word parts and their meanings. Here ends the Chapter 13 Male Reproductive System lecture.